just 4 months. But his main complaint was what?
Anterior hip pain.
Anterior hip pain. When I checked him in the hip flexion, he had severe pain at about 90 degrees with kind of an empty end feel. And even when I was ranging him just back into lying down in neutral, you already winced.
Yeah.
Right? So one of the things I've been playing around with, especially on social media, a lot of people are talking about, is your psoas really tight or is it weak? And then they're doing like a lot of, like banded ankles and doing a lot of hip flexor strengthening. So I just started playing around with testing the strength, more from an endurance, not like a 2-second break test, but from an endurance standpoint. So this side, I just kind of keep them in 90-90, and I just hold. This side was the involved side. Yeah, but I was getting a baseline
2 years ago.
Mm-hmm. And push. And it's significantly stronger. But initially, when I tested, you could barely push against me.
Light pressure hurt like the Dickens.
Right, and one of the questions that you should always be asking patients when a manual muscle test weak and painful is, could you push harder if it didn't hurt? And sometimes it's 50-50. Sometimes they'll say, no, I couldn't. It's actually that weak. And other times they'll just say, like, tell them I just didn't want to push any harder because it hurt. Because a lot of times it may not really be weak. I felt like it tested so weak that I thought he was weak. But I didn't ask him that question, even though I'm saying you should ask that question. I didn't ask that question because it wasn't like a full eval.